it's staying connected. this afternoon. Joining me today is Deputy Chief, CMPD Deputy Chief Jeff Estes, Public Health Director Gibby Harris, Atrium Health Infectious Disease Expert Dr. Louis McCurdy, and Novant Health Senior Vice President Dr. Sid Fletcher. I want to thank Rick Hafner, who is providing our sign language services today. At 5 p.m. today, new statewide restrictions that Governor Cooper recently announced will take effect. This includes cutting off alcohol sales at 9 p.m. and limiting the hours that businesses can operate between 10 p.m. and 5 a.m. All of this in an effort to try and balance the need for safety as well as the need of businesses. I would like to begin, as I've done over the past and during all of these news conferences, is to remind everybody how crucial it is to follow all of the executive orders issued by Governor Cooper. We learned today that there's been 7,500 new cases in the state of North Carolina and 2,500 hospitalizations. According to the state's updated data map for counties released this week, our COVID-19 numbers have moved us into the orange zone, up from yellow and close to red, which is the color that all of our surrounding counties are currently classified. On the map that the White House Coronavirus Task Force compiles, Mecklenburg County is a red county. And just as we faced a few months ago or a few weeks ago with Thanksgiving, more holidays are around the corner, and each presents another round of challenges. We need to do all we can to stop the spread of the virus. I believe that for this holiday season, the greatest gift you can share with those you love, with those you care about, and with yourself is to do what we all know keeps us safe. Wear a mask, wash your hands, stay 6 feet apart, and please, especially this year, avoid crowds, gatherings, parties, and those you do not live with. Until a vaccine is widely available, these are the only true defenses we have against this spike which we are seeing and which we know will only continue. The optimistic news is that the vaccine is coming, and today we are pleased to be joined by representatives from Atrium and Novant Health who will update the community on where they are regarding receiving and deploying vaccines, as well as the overall hospital capacity. Gibby will provide an update on the latest Mecklenburg County COVID-19 data and plans public health is making to receive and distribute the vaccine, and then we will take our questions. Now I'd like to bring up Deputy Jeff Estes to provide some information on enforcement. And before they do that, I just want to take an opportunity to thank Jeff for all of his hard work and being part of our policy team. Jeff's going to be retiring at the end of December, and I just want to thank him for all he's done to help us as we fight this pandemic in Mecklenburg County. So Jeff, thank you very much for all you've done.
Thank you, Madam Manager. It's been my honor and privilege to be a part of the only part of the CMPD and the City of Charlotte Mecklenburg County team, but also the COVID team to be able to help our community transition through one of the I guess, life-changing times of our lifetime. So based on the new order, I'd first like to talk about what we've done and are continuing to do, which is we will continue to conduct our inspections on businesses, primarily as relates to complaints that we receive from individuals and also other businesses. But we will continue to enforce and escalate enforcement based on the observations that we get from the businesses and business owners. As far as the new requirements from the governor's order, what we'll do there is we'll continue on the same platform that we've been doing. We won't be doing proactive, randomized stops of people at night during the times. However, if we come across people who are out in the course of our normal duties, officers can ask questions in regards to the order and compliance with that order. So we won't be setting up roadblocks or checkpoints in relation to that. In short, but if we come across you out in the public past the hours, you may be questioned as to your whereabouts and compliance with the orders. I'd like to reiterate, we have seen large, widespread compliance with the orders up to this date. The ones that we have seen not in compliance, both businesses and individuals, we'll be dealing with, and as we have in the future, in the past, just like we will in the future. Now, one thing we've seen is that we've seen reports of just blatant parties, et cetera, that'll be hosted by groups who don't agree with the mask mandate or the governor's orders, et cetera. We would like to request or let those folks know that they They shouldn't do that. There are other ways with which you can express your disbelief in the science or disbelief in the disagreement with the orders. And then they can expect to see officers there present when they do host these events. So with that, I'd like to introduce Dr. McCurdy with some information regarding the healthcare system. Thank you.
Good afternoon, everyone. I appreciate the opportunity to update everyone on sort of the status at Atrium Health. As the community is aware, here in Mecklenburg County and around the greater Charlotte area, we continue to see an increase in the number of cases of COVID-19. With these increasing cases, we continue to see new patients being admitted to our healthcare system across the Atrium footprint. With this, we continue to be diligent in our approach to these patients, providing them care within our hospital system, providing them access to clinical trials that we have established in our healthcare system as well. And we do have a large number of people who we have had hospitalized in our hospital at home system that we've set up to try to care for people in their home with the coronavirus infection. With this, we've seen an increasing number of cases in our hospitals. We continue to assess that daily with meetings to try to manage the capacity at our hospital facilities across our footprint. With this, we continue to have access for patients both with coronavirus infection as well as those without coronavirus infection who are needing health care. Again, we have continued to see the increase in cases, and I think it should not go undiscussed here the importance of what's been discussed with our governor's restrictions, as well as the need for all of us to continue to adhere to the behaviors that we've put forth for COVID care, including social distancing, wearing masks, hand hygiene, and other things to prevent the spread of infection in our community. As we prepare for the upcoming weeks, we do anticipate having vaccine available. There's been much news about that in the last 24 to 48 hours. We continue to await approval by the FDA. We continue to await some information from the ACIP meetings that will take place today and through the weekend. We anticipate hopefully getting the FDA approval for the Pfizer vaccine in the next several days. And with that, we'll expect to accept vaccine into the Atrium healthcare system. Our anticipation is that we will be able to provide the vaccine to healthcare workers as early as next week with the vaccine being distributed, and we continue to make plans to have the vaccine accepted. As we all know, there's some storage issues with the vaccine, and so we continue to work through that and the process of administering the vaccine with hope that we'll be able to provide this vaccine to our healthcare workers and soon to our community. The other opportunity we continue to have is that for testing, and so it is important for those persons who are symptomatic who do need testing to be able to seek that out. And so at that, I'll conclude and introduce Dr. Sid Fletcher from Novant Health.
Thank you, Dr. McCurdy. I'm Dr. Sid Fletcher from Novant Health, and I'm the Chief Clinical Officer for the Charlotte market. It's a pleasure to speak with you today. I do want to extend my thanks to our community partners, Dina Diorio and Gibby Harris, for the coordination of really all things COVID during all of this, including the efforts toward the vaccine program that I'm going to speak to you a little bit about today. Two main topics I want to cover, vaccine and surge. So vaccine. We are very excited at Novant Health and have high confidence that the vaccine is safe and effective and that the approval process is being followed. Please know that while many in the media have said that this has been rushed, and we refer to it as Operation Warp Speed, so why wouldn't people think that we're going at a high clip? I think please know that this has been years in the making and has taken a lot of science, and the COVID level funding that you're seeing that has now pressed forward to be able to really progress quickly to develop these amazing vaccines. Contrary to what you've heard about changing your DNA or some sort of tracking that would be included in the vaccine, Neither of those things are accurate or true. In coordination with state and local officials, Novant Health has been preparing for procurement and distribution, and we are part of the North Carolina COVID-19 Vaccine Advisory Committee. Presbyterian Medical Center is an approved vaccine administration site. We procured ultra low temperature freezers. To Dr. McCurdy's point, these do, especially the Pfizer vaccine, requires a very low temperature to be able to keep that vaccine around before distribution. With approval of the FDA and CDC, we plan on receiving about 2,925 doses at Presbyterian Medical Center within 24 to 48 hours after that FDA approval. We're hoping that's going to take place either today or over the weekend, and that we would be able to begin vaccinations of the targeted 1A groups, so that would be the high-risk healthcare workers on the front lines, as early as Tuesday. First responders and long-term care facilities, including both staff and patients, are included in the 1A group, and there will be many people that are working on the vaccine for that particular population outside of the healthcare systems. Please know we're committed to diversity and equity of vaccines in the community, and our plans will reflect that. As the supply increases, we will also evolve our plans. And again, we appreciate the collaboration on the state and local level to undertake one of the largest endeavors of our time for vaccination against COVID, really in the name of public health. Please know, we are not out of the woods, and we cannot let our guard down. We have this much anticipated vaccine that we see right around the corner. Talking about vaccine, reading about vaccine doesn't get anyone inoculated, right? It's going to take a period of time. We're going to have to work through those phases to be able to get people that vaccination. So knowing that, we have to continue the things that others have said. We've been saying since the beginning of the pandemic that physical distancing, mask wearing, and hand hygiene is really paramount to try to prevent community spread of this. And like your families, we all know that we're going to have to really think about gatherings a little differently come this holiday season, which leads me to the second topic, which is surge, right? We need your help. Remember when we talked about flattening the curve early? We need your help in that again. We are seeing the highest numbers that we've seen during this pandemic in the local community. We're seeing an increased positive test rate in the community, and no surprise, we're at our highest volumes of inpatients since the pandemic began in March, and we do see projections of that progressing over the next 2 to 4 weeks. Much of that may be related to gatherings that happened around the Thanksgiving time. We need to see that not repeated during the Christmas holiday. And while we are, quote, okay right now, we have capacity and certainly are managing quite well. But again, this is a busy time of year for non-COVID related conditions as well. So I would tell you that with increased demand, the areas of most concern to us are really around our physical bed capacity and staffing. We do have contingency plans, which we certainly will activate if needed. And here's the good news. We are seeing a little bit less downstream need for ICU care, so we can work on trying to expand that medical surgical footprint. And we do have plenty of PPE, ventilators, and other supplies that would be related to any surge that we're going to see. Lastly, I would share with you that please know that when any group or phase is up to get vaccinated, we highly encourage and recommend that you participate in getting vaccinated. I plan on getting vaccinated when my cohort or my phase is ready, and I plan on getting my family vaccinated in the same way because I have high confidence in the vaccine. And with that, I appreciate your time, and I will turn it back to Gibby Harris. And at the end, I'm happy to answer any questions. Thank you.
Thank you, Dr. Fletcher and Dr. McCurdy, for being here today. I want to share with you just a brief clip of some of the things that we're seeing in our community. And it's not surprising when you see this clip that we have the highest number of cases that have been reported to us since the beginning of the pandemic. Our cases are up by nearly 30% over the last 2 weeks. We are setting new records for hospitalizations every day. We're on track to hit 50,000 cases this week since March. That's just 3 weeks since we reached 40,000 cases. So that's 10,000 cases in 3 weeks. These high case counts are reflective of the widespread virus in our community. With this level of viral involvement, the potential for exposure has gone up significantly throughout Mecklenburg County. We have seen examples over the past several weeks demonstrating that even when complying with masking and social distancing requirements, the COVID virus still spreads. It underscores the need for us to take additional measures to decrease the spread and the impact of COVID in our community. Some of our most recent numbers. Today, as of noon, we've had 49,560 cases. We've had 484 deaths. That's 484 individuals who will not be with us this Christmas in Mecklenburg County. We have 41 congregate sites. That's almost double in the last couple of weeks that are involved in an outbreak status. And that includes our jail. Our positivity rate is hanging around 11%. And our case rate for the last 14 days is at 585 per 100,000. And as the manager mentioned, we are in red status at the federal level. And if you look at our latest data, we are basically at the red status in the state level. That report will not come out again for another couple of weeks. One of the things I want to mention, though, is as all of these large numbers we continue to see these in Mecklenburg County, we are continuing to try to do the case investigation and the contact tracing that we need to do here in Mecklenburg to make sure that people know that they're infected, and also to try to get in touch with contacts to help them know that they need to quarantine. Our case investigators continue to work tirelessly 7 days a week to investigate these cases, but as our numbers increase exponentially, we are having to make some adjustments. We want people to be aware that we are prioritizing our telephone calls and our text messaging efforts to a certain group of people. Anyone who we receive a test result of 8 days and less from the time they were tested, we will make that effort to get in touch with them. Unfortunately, we are receiving some results that are further out than 8 days from the original test, and at that point, there's really not much we can do in those situations. We are contacting all cases who are known to be part of an outbreak or cluster. We continue to contact any case affiliated with any child care, school, or secondary education institution in Mecklenburg County, and any cases with other known risk factors, such as congregate living sites and high-risk occupations. We're also contacting all cases of anyone who is 18 years of age or younger. We'll continue to identify and prioritize cases that are linked to long-term care facilities, shelters, congregate living settings, and other identified high-risk settings. And we'll continue to follow up on all cases reported to educational institutions and high-risk employers. We ask that if you receive a call or a text from us, please respond to that. We're making sure that all of those who are doing testing in our community will follow through to make sure that they provide test results, positive test results at least, to the individuals that they've tested. I'll say briefly, you heard from both of the hospital systems about COVID vaccine. We are working with our partners under the direction and leadership of our medical director, our public health medical director, Meg Sullivan, as a group to make sure that we're working together in moving forward with vaccine in Mecklenburg County. The intent of the group is really to make sure that we're providing consistent messaging, that we're providing equitable vaccine delivery to prioritized individuals and populations in our community, and that we're sharing data so that we can inform the community of what's going on with vaccines. You've heard the hospitals will have the initial shipments. The health department will be receiving shipments the week of the 21st of December. At this point, we have not heard how much. We do have prioritized populations in phase 1 that has been determined by both the CDC guidance as well as the North Carolina Division of Health and Human Services. That initial focus will be on hospital workers at higher risk of exposure to COVID, state certified and EMT paramedics who have direct patient care duties, and public health staff who are working in vaccination clinics. We're working on the process of making sure that those vaccines are available. The health department will be responsible for the EMTs and the paramedics in the community, as well as the public health staff, and for some of the long-term care facilities that have not signed up for the federal program to get their residents as well as their employees vaccinated. And that's just phase 1. We're continuing to get guidance from the state and the federal government about the next phases, and we'll continue to update the community as we know who will fall into those categories. I want to reemphasize the need for us to limit our exposure by staying at home when at all possible, limiting all activities outside your home to essential needs. The vaccine is our future. It's not our present. We have huge numbers right now in our community, and the amount of vaccine that's out there is just putting everybody at risk anytime they go outside of their bubble. A few holiday reminders: virtual parties. Be creative, but don't get together person to person. Online and curbside shopping. No gatherings outside of your immediate family, and no traveling. At times I feel like the Grinch, or maybe Scrooge, but unfortunately, this is 1 year in our life. It's 1 year where we're asking people to do things differently so that they will have more years in the future and that their loved ones will have more years in the future. We need you to do the things that we're asking you to do. That's the only thing that's going to get us through this phase as the vaccines start taking hold. And we really appreciate all the help that you can give us as we move through this holiday season. So we'll open for questions at this point.
Hi, this is Katie Peralta with the Charlotte Agenda. I had a question for either one of either Dr. Fletcher or Dr. McCurdy. I'm just curious, how close are the hospitals to once again needing to pause elective surgeries because of the need for ICU space for COVID patients?
This is Sid Fletcher. That's a great question. I would tell you that we are constantly evaluating that and looking at the data. That certainly is one of the triggers that we may pull should it be needed. Just recognize there are patients that need and require those kinds of advanced procedures that we're talking about, and we really refer to them as non-time sensitive surgeries. Some of those do require some hospitalizations. If we need to take a pause in that, we will. We're really not close to that mark current state, but that is one of the triggers that we have.
Yeah, I can just reiterate, Dr. Fletcher, it's something we continue to look at on a day-to-day basis with our surge team and our capacity team. At this point, we don't have plans to change the opportunity for people to have surgeries. As Dr. Fletcher said, we look at those surgeries based on different levels and the need for people to be in the hospital versus out of the hospital. And so it's something that we'll continue to look with this surge to make sure that the patients are taken care of the best they can.
All right, thanks. It's Tony Messia with the Charlotte Ledger. I just had a question either for Gibby Harris or possibly Dina DiOrio. Since March, the health department has taken a very active role in being an advocate for public health. It's my understanding Ms. Harris basically wrote the original stay-at-home order in March. You all have signed orders that resulted in the alcohol licenses being taken away from clubs like Club Onks, El Centenario. You've been working closely with private schools to recommend whether they should open or close based on transmission they're seeing in their schools. Recently this week you had the CMS board some of the members were saying that they haven't really gotten clear guidance from medical professionals about whether public schools should be open and closed. So given all of that, why doesn't the health department clearly say whether it's in the interest of public health for public schools to be open or closed?
In many of these cases that you're talking about, we provide guidance. We don't always provide specific recommendations. We worked with the school systems to develop the metric system that they're using right now, and we've also looked carefully across the country and looked to some of our federal experts for information and guidance around what's best for schools. What I can tell you is we know what the situation is in the community regarding COVID and the potential impact and the potential exposure that people have by coming into schools. We are not experts on education. And in terms of what's best for the children in terms of education, that has to be part of the decision-making process. So we work together with the schools rather than making specific recommendations or telling them what they need to do around whether schools are open or not.
Thank you.
Next question.
Hi, this is Caroline Hicks with WBTV. As the focus kind of leads towards vaccinations, is there any concern about test results for COVID-19 being delayed as the demand for testing continues to increase? How will that be balanced while they start the vaccination process?
I know that all of the partners that we work with, including both hospital systems, are committed to continue doing the testing that's available in our community right now. Even as we move into vaccinations, there may be times when we're ready to do vaccinating in the community that we're doing testing and vaccinating together at the same time in the same location. So we're looking at all of that, but we're committed to making sure that testing is available, because that is, along with vaccination, that's one of the key elements that we have available to us to try to manage this pandemic.
This is Allison Kuznets from the Charlotte Observer. I have a question for Dr. Fletcher and Dr. McCurdy. There was recently a briefing from UNC and Duke University showing that our local hospitals in Charlotte could hit capacity within 4 to 5 weeks. I was hoping you could provide some context if that forecast is accurate to what your models are showing, and if so, really what that means in caring for coronavirus patients in the coming weeks.
Yeah, so I think obviously with an increasing number of cases in the community, we anticipate that there could be an increasing number of cases in the hospital. So I think as many healthcare systems around the country have done, we've created some modeling system to try to sort of anticipate what those numbers look like. With those models, we're able to make some changes around how we care for patients, whether that be in our usual hospital setting or the ability to sort of create space for certain types of patients. At the same time, I think as Dr. Fletcher had mentioned earlier, one of the key components is sort of staffing. So we continue to assess our staffing to make sure that we have the appropriate teams at our facilities to take care of those patients. So we have anticipated with some of our modeling that there will be increasing number of hospitalizations, potential need for increased ICU care as well as ventilators. And we've anticipated that working very closely with our ICU teams, our critical care teams, to let them know what that will look like so that we can anticipate that surge. I think the keys, again, are the ability for us to manage our patients as we move through the healthcare system. So again, something that we're taking very important at Atrium around our ability to use some hospital at home work to get patients back to their home setting where that's appropriate. So we are looking at multiple different models to try to anticipate an increasing number of hospitalizations that we'll have in the next couple weeks just based on the data. Again, one thing that the community can do to help with that is to do all the things that we've talked about, stay at home, try to prevent the increased spreading of the coronavirus. Again, one thing we don't have to accept is that trend will continue. I think we all have the ability in our communities to act so that we can hopefully dampen that, as Dr. Fletcher said, with dampening the curve. I don't think this is something we have to accept that we're going to be at capacity. I think it's something that we can all act on.
Dr. McCurdy said it well. What I would tell you is that based on the modeling that I've seen, I believe in the short term, in the next 2 to 4 weeks, while we do see increasing numbers, we believe we do have an opportunity to be able to manage that capacity. We don't want to see that number continue to climb, and we don't want to see post-holiday numbers at Christmas like we saw from Thanksgiving, or there certainly is an opportunity to be in a difficult position. And I would say that's really around not only physical beds, but also the staffing for those beds. As you know, the people that work in our facilities, they're community members just like all of you. And so we do have some people that are out, that are quarantined, all kinds of other issues that do contribute to some of that challenge. I would tell you that the treatments that we've seen and the way that we're managing patients at this point in the pandemic has improved. Some of that is around the pandemic, some is really around treatment options where we've had less need for ICU capacity, but we know with the climbing number of patients in the hospital, some of them, even if it's a declining number, will require intensive care, and that requires not only an intensive care unit level bed, but it requires that level of staffing, which is, all the more ramped up. So what I tell you, short term, I think we're okay. We need help so that we can manage this, past that 2 to 4 week mark that you're talking about.
Hi, this is Elsa Gillis with WSOC. Thanks for taking my question. It is tied to the videos that you showed, Gibby. I couldn't exactly tell where they were from, but we're being sent similar videos, most recently from QC Social Lounge. That might have been what you showed, showing people packed in, no masks. Are you in touch with that businesses that you're seeing doing this? Is anything being done? What is your message for the people who were there, and what would you say to businesses to discourage them from allowing that behavior?
I think the main thing that I would say right now is that we have a lot of businesses in our community that are doing what they need to do. They're making sure that the people coming in for service are being socially distanced, are wearing masks, are doing the things that they need to do that they've been asked to do through the executive order. We have a lot that are in that category. We have a handful that continue to operate the way you want, and this is QC Social. And I think it was from last night. It was on social media this morning. And they have another event tonight that we're aware of that may look the same way. And what we will be doing, we've already talked to CMPD about checking into that. We have our COVID ambassadors who are making regular rounds with a lot of the restaurants, bars, breweries, to try to make sure that they are doing what they need to do, making sure they're educated about what they need to do and that they have the ability to do that. But it's a handful that we continue to see that are presenting situations like this. For the individuals that were there last night, my recommendation is that they quarantine for 14 days. I'd be very surprised with the amount of COVID virus that we have in our community if there was not COVID in that space last night. So it's a good possibility they were exposed. And they can get tested in 5 to 7 days to see if by chance they have become COVID positive. But they took the risk of going to that facility. The problem is it's not just a risk to them, it's a risk to others in the community when they expose themselves like that. So we are asking everybody to do what they need to do. When you walk into a place and it looks like that, the best thing you can do is turn around and walk out and not expose yourself.
Ben Briscoe at WFMY here. What do we know about the possible reinfections today, and how concerning is that to you?
I don't have a current number. The last time I looked at the numbers, we were in the, I think 30s, at least 30 to 40 individuals that we had recognized they tested positive again after an initial test of over 3 months ago. And basically what we're hearing at the federal level is that can be considered a re-exposure or a reinfection. So we are continuing to watch that closely. It is not a significant number at this point in our community, and we're hoping that it won't be. And as we move into vaccinations, we'll be encouraging those folks as well as everybody else to get vaccinated. Last question.
Gibby, I have a question again. This is Katie Peralta with the Charlotte Agenda. The video that we all saw circulating this morning, there have been others like it. I mean, this is not a one-off by any stretch. As conditions continue to worsen in Mecklenburg County, with all of the people we have here, with the fact that the holidays are coming up, why isn't the county opting to enact further restrictions to help slow this thing, even if technically the rule breakers are in the minority?
So at this point, the leaders in Mecklenburg County have all agreed that we will comply with the governor's order. I don't believe anything is off the table. I think we'll continue to watch that. But as I said earlier, we really want our businesses to be open, as well as our schools, as well as we don't want our hospitals to be overwhelmed. So we're going to do what we need to try to make that happen. But we don't want to close down businesses unnecessarily, because that hurts us in other ways. So we're continuing to try to work with those individual businesses where we see these issues to try to prevent them from continuing to happen. Thank you. Have a good weekend.